Hello, everyone. My name is Diane Cohen, and on behalf of Work Comp in Motion, I'd like to welcome you to today's presentation. Before we get started, I'd like to share a little bit of housekeeping items so that we can all be on the same page. So a copy of today's presentation is on your control panel. Please be sure to download that while the presentation is going, because once the presentation is over, you will no longer have access to the PDF. For those of you who need to have CEU credits, you will receive an email tomorrow and it will say your certificate has arrived. Please make sure that you click onto the blue button and download that for your records. And then if you have a question for any of our panelists today, we do have a question or chat box that you can write questions in. Carlos will be reading those questions to the panelists and they will be answering your questions. I'd like to thank our sponsors for today's event, and they are WorkPartners, MacroPro, SMS, ProCare, GenX, NewQuest, iRatings, Learning Services, Ember, Optimum, DentalWorks, and California Orthopedics. So today we have a great presentation on addressing employees' concerns about COVID-19, and we have a fantastic panel for you. It has been led by Carlos Luna. Carlos, thank you so much for putting the panel together for us today, and I am going to leave it to you to introduce everybody.
Thanks, Diane. I appreciate it. First of all, I want to do a tech check here, and I want to make sure that you can all see the first page on the slide. Diane, let me know if you can see the first page, the title page on the slide.
We can, but you do need to put it into slide presentation mode, please. Perfect.
Excellent. Well, thank you all again for Diane. Diane, thanks again for the introduction, and thank you all to the audience for spending a little bit of your day with us today. I'm extremely excited to walk you through a discussion that I know will be equal parts engaging and thought-provoking, addressing employee concerns on COVID-19. Now, for those of you, bear with me here as I switch my slides. For those of you that don't know who I am, my name is Carlos Luna. I work for a company called Risico Total Managed Care. It's a URAC accredited division of Risico Inc., which is based in Fresno, California. Risico is a multifaceted organization that provides third-party claim administration services, managed care services, and offers workers' compensation insurance products to thousands of customers throughout California. I also have the privilege of serving as a board officer, as vice president for an organization called the Hispanic Insurance and Risk Management Association. I've worked in workers' compensation for about 12 years now, and while my career started on the front lines in disability claims, coordinating return to work, over the years, my expertise has developed into incorporating evidence-based medicine standards and tools into claims and clinical workflows to achieve improved health care, return to work, and financial outcomes for workers' compensation stakeholders. I'm joined today by a group of very accomplished individuals. First, I want to introduce Dr. Randall Browning, who is the Chief Medical Officer for WorkPartners Occupational Health Specialists. Dr. Browning graduated with honors from the University of Texas Medical School at San Antonio. He received a Master's of Public Health degree from the Medical College of Wisconsin and a Master's of Business Administration from San Diego State University. He's a board certified in emergency medicine and medical toxicology and is a fellow of the American College of Emergency Physicians. Dr. Browning has more than 25 years experience in occupational health. The second panelist, Mr. Michael Simmons, is the Vice President of Risk Management for WKS Restaurant Group, one of the largest franchisee organizations in the US, and has worked in the risk management industry since 1986. Michael oversees the company's risk management, safety, loss control, insurance, claims, and security programs that contribute to the profitability and reputation of the brand. Michael teaches business management courses for undergraduate and graduate students at the University of Phoenix. He holds 2 master's degrees in organizational management and criminal justice administration and is a doctoral in business candidate. He has an awesome sense of humor and is an all-around amazing guy. You'll get to know him today. Thanks for being on the panel, Mike. Lastly, we have Mr. Tyrone Spears. He works for the City of Los Angeles as the Workers' Compensation Administrator. Mr. Spears is responsible for managing the day-to-day operations of the city's workers' compensation program. Tyrone holds a bachelor's degree of science in human resources management and an executive MBA in management. Professionally, he holds the associate in risk management designation, senior certified professional by the International Public Management Association for Human Resources, and the Workers' Compensation Claims Professional designation from the Insurance Education Association. My thanks to our panelists, Michael, Tyrone, Dr. Browning, for taking the time to participate on what I consider this to be a very important conversation. And to the wide audience or to the broad audience, please be advised, the information that we share today is for educational purposes only. It should not be considered legal advice. So to say that employees are grappling with anxiety and stress in numerous aspects of their life during this unprecedented time in history, both at home and at work, would be an understatement. In May of this year, the United Nations Secretary General Antonio Gutierrez urged, quote, governments, civil society, health authorities, and others to come together urgently to address the mental health dimension of this pandemic. The Secretary General further cautioned that, quote, even when the pandemic is brought under control, grief, anxiety, and depression will continue to affect people and our communities. According to a recent white paper authored by my friend Marcos Iglesias, MD, he happens to be the Chief Medical Director at Travelers, he states, stress at work is normal as a result of the speed of change, job expectations, deadlines, scarce resources, competition, interpersonal conflict, technological changes, regulatory and legal issues, etc. Uncertainty is also very stressful, and we are indeed living in uncertain times. Dr. Iglesias writes that Mental Health America reported a 19% increase in screening for clinical anxiety in February, which can be considered the early stages of the pandemic. Express Scripts, a leading PBM, reported a 21% increase in antidepressant, anti-anxiety, and anti-insomnia prescriptions between February 15th and March 15th of this year, according to Dr. Iglesias's paper. With stress affecting us and our employees in many negative ways, emotionally, cognitively, and physically, the strain due to the stress of COVID-19 is undoubtedly being felt by employers in just about every business vertical. So to set the stage for our discussion today, I want to call on Dr. Browning to share with us what he's seeing from a clinical perspective. As I mentioned earlier, he works for WorkPartners, who services hundreds of employers in the San Diego area by treating their employees, and by all means is considered a frontline group. Dr. Browning, can you paint a picture for us of what you're seeing in your clinics right now from a clinical perspective?
Yeah, sure. So in our clinics, we only see employees that have been sent in by their employers for one reason or another. And in this COVID setting, we're only seeing employees that are sent in by their employers for a COVID evaluation. So we have a little bit different perspective than what you see on the news every night, which is dealing with the general population. We do about 600 to 700 COVID tests a month in our clinics, and we have about a 13.5% positivity rate, which is nearly twice what the positivity rate is for the United States in general and for California, which tends to run about 6 to 7%. I think the biggest reason that we have a higher positivity rate amongst employees is selection bias. I think that these employees are being sent in because there's a COVID concern by their employer. Either they've been exposed or they have symptoms. or there was an exposure in the workplace or something like that. Now, there are two big differences between COVID testing in the general population and COVID testing in the occupational setting. The first difference is that in most publicly accessible COVID stations where you drive your car up and you get your swab taken, they don't test asymptomatic individuals. But that's really not acceptable in the occupational setting. I mean, if say you have a situation where you've got a small tight-knit group of workers that work together, some unit that works together very closely, and they're going to bring in somebody else, a new employee, and those people in the unit might say, we want to have this guy tested to make sure that he's not COVID positive yet asymptomatic, so that he doesn't come into our tight-knit group and spread it around the group. So that's a situation where we might want to test an asymptomatic person, and there are other situations as well. The other difference between the general population and an occupational setting is that employers are keenly concerned about return to work decisions. Now, the CDC does address that in their guidelines. They emphasize what we call a time-based return to work or a symptom-based return to work. And what that means is that you take a look at when your last positive COVID test was, and then you make a determination from there when it's safe to return to work, or you look at when your symptoms started and when your symptoms ended, and then you make a decision using those data points when it's safe to return to work. But you can imagine that for employers, that's often not good enough. They say, I want to have a negative COVID test before I bring this person back into the workplace. Again, same scenario where you might have a tight unit of workers that work closely together. One of those workers has been out on a COVID plane, because he had COVID, he or she, and then when it's time for them to come back to the workplace, the employers are saying, I want this person tested negative before they come back in here. And there are lots of situations like that. Problem of requiring a negative COVID test before returning to work. It seems so obvious, doesn't it, that that would be the thing to do? But the COVID tests stay positive for 1, 2, 3, or more weeks after the illness is ended. After the person is asymptomatic. They're no longer shedding the virus. They're no longer contagious, yet that COVID test can stay positive. So that's the downside to requiring a negative COVID test before we go back to work, is that the person may be out of work longer than they need to be. But the point of all this is that we need to work with employers. Every workplace is different. Every workplace has different requirements. So we have to work with employers to come up with the right strategy for return to work for each individual company. And with that, I'll hand that back to you, Carlos.
Well, Dr. Browning, I certainly appreciate your insight. You guys are indeed on the front line, and we appreciate you sharing those tidbits with us. Now, the inconsistency as it pertains to the testing and the I don't know if you would call them false positives after the symptoms have subsided adds to the anxiety and to the insecurity of returning to work and the things that we're having to face as employers, as employees as well. And really, as professionals in the risk management, workers' compensation, and occ health world, we've somewhat been conditioned to tread carefully on mental health elements or with regards to the implications of mental health due to the prospective risk of implications by way of psych claims. So my next question is really to all of you. What is each of your organization's view on mental health and the role that it plays during the COVID-19 era with your employees? Why don't we start off with Mike and share us your thoughts on WKS's perspective on that?
Thanks, Carlos. Well, for us, we kind of, when this whole thing first started, we wanted to kind of do a little bit of an introspective of what we felt the resiliency of the organization was going to be when it came to our employees. And we knew that the one thing that was likely going to drive the COVID-19 response and how we dealt with it was largely going to be around how the employees were emotionally dealing with not only what was happening at work, but what was happening at home and what's happening in the schools and what's happening in the supermarket when all the toilet paper flew out of all the stores. I mean, we knew that there was going to be all of these stressors that were coming into play. And so we focused on the one thing that we felt that we could impact them most greatly with. And so we decided we were going to over communicate. And everything that we were doing from a planning perspective, from a response perspective, it was important to us at that time that we were, I hate to use this term, but we were in their face. We wanted them to know. We started doing immediate meetings where we were calling either our support center staff or our field staff on the meetings. And these are occurring twice, once a week for each segment. And we were providing them with information about what was happening. And in fact, I affectionately became COVID man here. That's what I've been called for 5 months, which is a little embarrassing, but it is what it is. So, I mean, I'm going to get a T-shirt, I think, that says COVID man when this whole thing's over. But that's what we did. We decided we were gonna push communications out. We weren't going to require that they come to us. Weren't going to require that they go and look for alternative sources of information. That was a narrative that we felt we needed to control in order to maintain their emotional and their mental health as it related to engaging in the workplace.
Tyrone, from your perspective, how does the City of LA view mental health and the role that it plays during this era for its employees? And what are you folks doing?
Yeah, so just to echo kind of what Mike said, communication was important. Here at the city, mental health, as it relates to the pandemic, has been really at the forefront because we are a large city. We have a large employee base. So in addition to communication, we provided communication about the pandemic, about what the city was doing. Also, we pushed out to our employees different resources within the city and within LA County that could help them and maybe their family members, because we were aware that, we had a lot of staff members that were concerned about parents or, elderly grandparents, children, childcare, that sort of thing. So we also had a daily kind of blast and weekly blast of where to get resources so they can help lead and direct their family to those resources. And that was one less thing they had to worry about. And then also we enhanced our EAP program with allowing additional visits, almost unlimited visits for employees and their families to talk to someone, talk to a professional, because we know, during these uncertain times that people were just, borderline depressed, stressed out, anxious, not knowing, what was going on and if they were going to be affected and that sort of thing. So our benefits team jumped on it right away, increased our service levels with our EAP vendors and pushed that out. And then for our sworn personnel, we also deployed clinicians on site. So they were in person where the staff could go in and talk to them as needed. And then they would be there during the stand-up meetings and roll calls and that sort of thing, just to make sure that our employees knew that, we were concerned about their mental health and about all the uncertainty and how they were affected. And so we wanted to send that clear message. And again, like Mike said, communication, it was changing. We didn't know what we were doing at first, but we tried to do the best we can to put the communication out there. But that communication changed daily, weekly at the beginning of this. But it was important for us to address it on all fronts, not just communication, but also those tangible resources.
Well, we're extremely fortunate to have both your insight and Mike's insight, both representing employers from very different environments. As you can imagine, we have probably small employers to very large employers watching this webinar today. By the way, if you just joined the webinar, I'm Carlos Luna with Risico. I'm joined by Dr. Randall Browning from WorkPartners, also by Mr. Mike Simmons from WKS Restaurants, and by Mr. Tyrone Spears from the City of LA, administrator of their workers' compensation program. Thanks for joining us today. With the various sizes and employers that we have watching this webinar today, gentlemen, is there a sweet spot? Is there a recommended amount of focus, if you will, that an employer should put on their workforce's mental health in order to preserve safety and productivity in the workplace from your perspective. Tyrone, why don't we start with you this time?
Yeah, I mean, I think it's key. You know, we've done a lot for our workforce in total citywide, but just personally speaking, for my staff in the workers' compensation division of the personnel department, you know, it was important for me as a leader to make sure that I was sending clear messages and that I gave them an avenue and a place to voice their concerns. Of course, when the stay-at-home orders came in effect, we had to move most of our workforce to remote working at home. And as you know, anybody that works in, you know, government, public entity space, you know, telework, remote work is just not usually customary, and you don't see it that often. So we weren't really prepared for that, but we ramped up and, you know, got people home, and then we allow people to come in as they need it or as they felt comfortable. And I think that given, you know, the current climate that we're in and the level of the pandemic that we're in, we plan to carry that out, you know, into the future, kind of indefinitely at this point, allowing people to work from the office as they feel comfortable, and we'll always have this new normal of some level of remote work and remote working from home. So again, we want to make sure that our staff feels comfortable returning to the workplace. They're safe. Our building has went through this whole new kind of revamping of bathrooms. You know, every other stall is marked off with yellow tape like you're at a crime scene, which is pretty interesting. You know, every other sink is you know, roped off with this yellow tape as well. And we have signage, and the signage is real important so that people know as they enter our building, they enter into the workforce, that, you know, we really want to make sure that the staff feel safe and they know that the city is taking their health and their safety seriously.
Mike, from your perspective, how much do you think employers, from small to large, of course it's going to vary, right? But from your perspective, how much should they focus on the mental health aspect of their employees?
Well, I think the emotional and mental health of the employees is going to determine a lot of things. It's going to determine how resilient the organization is over the short and the long term. We came to that conclusion right off the bat. And I think whether it's a small or a large employer, I think how you deal with the employees and their emotional mental health and how you communicate with them, I think all that's scalable. I'm not necessarily sure that a small employer had an advantage over large employers because the situation was completely dynamic. It's something that we really had never encountered, at least not encountered to this level, of this scale in history. And it was something I think everybody found themselves basically walking around in diapers trying to figure it out because we were all new to it. So I think it was scalable. I think it came down to leadership and decision making and how you engaged with the employees up front. I'll give you an example. WKS, you know, we have operations in 17 states. Every state has multiple counties, and so we were faced with changing health department orders almost on a daily basis in multiple counties and multiple states, impacting one restaurant or up to maybe 10 restaurants or even more. And so for us, we had to be completely agile. We had to be completely flexible in how we responded to that. And we had to kind of retrain our employees and retrain our staff that, look, this agility and this flexibility is going to make it easier on you from an emotional and mental health perspective. You got to kind of take the stride with us. It's a leap of faith, but please trust your leadership, trust the communications we're giving you. There was a lot of misinformation that was coming out of the media right off the bat. Everybody's watching the 6 o'clock news in the beginning of this thing. And we had employees who were watching that and then coming in and parroting that information to other employees. That could be devastating to the emotional and mental health of staff. So we were doing the best we could to put together information from multiple resources. We had 12 or 15 different websites at any given time that we were monitoring, and we were pushing out that information so that we could try to cut down whole rumor pool that would, that seems to run amok. And I think, again, I think that's scalable for any size organization, and I think it's so far it's worked for us.
Well, I love the fact that you identify that it's scalable. Certainly, the message that I'm hearing loud and clear is that one size does not fit all, right? So you really have to pay attention to what's going on within your organization and scale it appropriately. So one of the things that I'm really, feel fortunate of is to have both Michael representing a large private sector employer, very prominent throughout the country, as well as Tyrone representing a large, prominent public sector employer. Is there a difference between public sector and private sector employer responses to COVID-19 as it pertains to addressing concerns from their employees and how they support them through this uncertain time? And by the way, Dr. Browning, I'm going to pick your brain a little bit on what you're seeing in the clinics as it pertains to both public and private. I'd love to hear your thoughts as well. But Michael, why don't you share your thoughts from your perspective? What do you think some of those differences are, or maybe speak specifically to the private sector and how you guys are dealing with it?
Well, I've had the opportunity to work in both the public and the private sector. I got to work for a large community college district for about 7 years, and I've worked in the private sector the balance of my career. I think that there are some differences, but I think it comes back more to accountability. For instance, in the public sector, you're dealing with boards of trustees. You're dealing with a leadership that has a little bit of a different mindset, or maybe even a lot different mindset than the public sector, private ownership, even family-owned businesses. I work for a large family-owned business. So my accountability, my messaging, my communications to them would probably be vastly different than the communication chain that Tyrone has to go through. For me, I think we in the private sector, because we can make decisions that are supposed to not only be beneficial for the employees, but also beneficial for the organization. And I think that because we have a very straight up and down tree of communication in our chain of command, I think it makes it easier for us to probably be more agile and flexible than it would. And at least that was my experience in the public sector. When I worked for the college district, it was like trying to turn a battleship around in a bathtub whenever you try to get something done. And so I think that's probably the differences. It would be the time and the accountability.
Tyrone, what are your thoughts?
Yeah, I mean, I think there are some differences. For me, I would say that, when you have a large public entity, we have about 33 operating departments, and majority of those large departments operate as almost separate organizations. Mm-hmm. And so it's sometimes challenging to get out the effective message when you have 33 different operations running somewhat separately, but together. So I would agree that, sometimes there are challenges there. But we made sure that we met with the mayor's office staff and the task force very early on, before we even had the first case of the public transmission in LA. And we just kind of laid out our plan moving forward should we have to, have these stay-at-home orders and that sort of thing. But it is challenging, but I think at the end of the day, an employee is an employee, whether it's a public or private sector, and we have to be concerned about our employees and make sure that they're front and center of our decisions to make sure that, our workforce is safe. But from the whole view of it, there are differences with public and private sector employees. For instance, I have to deal with first responders. First responders are on the forefront. They're there assisting citizens that may have, positive COVID findings. And they're dealing with these people front and center, just like our healthcare workers. So our exposure is a little higher. And so we have to make sure that, our protocols falls in place for first responders, sworn personnel, as well as our civilian personnel. So we have a lot of moving parts. It is an issue that we are dealing with here at the city. I mean, we're over 400 claims. We're bumping against 500 here shortly. And so it's an issue for us, and we've been dealing with it. A lot of lessons learned. But again, our employees are at the forefront of our decision-making, our procedures and policies.
Tyrone, and this specifically for you, I imagine being, of the scope that the city of LA is, you have many, many job functions, many job roles. Do you have disparate protocols for each job role, or are they similar? And how has that helped manage the response from the city of LA's perspective?
Right, good question. Yeah, we have, probably a couple hundred different job classifications throughout the city of LA, because we have, everything from the LA World Airport to LAPD to the port, the harbor, to the library. We're a full service city. We pick up our own trash, we clean our own streets, and that sort of thing. So very good question. To answer the question, basically we try to have one voice when it comes to especially COVID-19. And so we rely heavily on our medical director for the city of Los Angeles and the task force. And we try to send out these executive memos, and it's for citywide. So we don't allow the operating departments to kind of have their own. I heard Dr. Browning talk earlier about, negative tests versus, time or days. We had that going on. Some supervisors, some departments, some general managers wanted to require 2 negative tests and that sort of thing. And so we had to quickly rein everyone in and let them know that this is a city policy. No one is to go outside of this. This is signed off and approved by our medical director. And that's how we handle it, to make sure that there's one voice and we don't have 33 different departments coming up with different policies and procedures. And as you can imagine, that was tough initially getting out, but once we kind of got everybody on board, it was easier to get everyone to follow suit and, support the recommendations and the policy of the city.
So clearly reducing the obfuscation, confusion, even at the leadership level, and making sure that you have one clear message, one clear directive is a lot easier to disseminate and to enforce through a large agency like the LA city. So certainly appreciate that input. Dr. Browning, from a clinical perspective, so you see patients from employers, on both sides of the fence, right? From your perspective, what are the key differences that you're seeing through caring for these employees for both private and public sector employers?
Yeah, so Carlos, I think as you pointed out in your literature review, there are measurable increases in anxiety, depression, substance abuse, domestic abuse during this pandemic. I think the important thing for people to recognize is the magnitude of this issue. Studies are showing that upwards of 50% of adults have been negatively impacted on their mental health during this pandemic. And so when we're seeing patients, whether it's through our telehealth platform or in person in the clinic, we have to recognize that if they're furloughed, if their life has been put on end because of this condition that we're in, we just have to recognize that they might be suffering. And whatever sector they're in. I don't really see that much difference between the two sectors, with the exception of first responders might be exposed and healthcare workers might be exposed to different stressors. But the main thing I want to point out is that it's just important for doctors and employers to just recognize that there might be a problem there, and your patient or your employee might not come out and tell you. So I think it's incumbent upon the doctors and even the employers to say, hey, is everything okay? I haven't seen you for a while. You've been on furlough. Maybe you have this injury. Maybe you had a COVID scare. Is everything okay? And studies have shown us that most people are more than happy to be asked that question, are you okay? It's not too probing. It's up to them. If they want to answer, they can. If they don't have to. But even an employer can ask that. I think it's important so that people have a door to go through if they're suffering from mental health problems, substance abuse problem, whatever it is. And then once we open that door, then maybe there's some way that we can help that person.
You know, it's without question that the working landscape.
It appears that Carlos is frozen at this time. We'll give him a minute to be able to reconnect with us. Until then, gentlemen, would we like to continue the conversation a little further and maybe talk a little bit more about resiliency?
Yeah, sure. I have the question here. I can go ahead and answer it. I'll ask it. In addition to employees having a sense of resiliency, employers must equip themselves to respond to COVID-19 with agility. What should employers ensure that they have in their toolbox to support their organization ability to be agile? And Mike, you've already kind of hinted on that and started on that. Can you add some more to that question?
Sure. I think in the beginning of this, one of the things that we were concerned about was that our employees would think that we weren't being transparent, that either because of our personal political leanings or something like that would be influencing and would be creating noise in the channel when it came to the way we were communicating with them. And we knew that one way we could make them more resilient and make them more engaged with us as the employer was to be completely transparent. We opened up all lines of communication. We took down all silos that might be perceived in the organization. We made sure that, and we gave them a forum. We gave them a place to come and have a communication and have a discussion with us. That, and in fact, then when we provided them with answers or provided them with a feedback to that, we made sure that it was backed up by information that we were receiving, and gave them sources, gave them an opportunity to go out and look at that information for themselves. And I think what that did is it helped them build up a little bit of resiliency that they may not have had prior to the outbreak. And it actually helped them, and I like this word, it helped them trust the employer more, thus making them a little bit more resilient.
Hey guys, can you hear me now?
Yes, we can.
Yes.
Sorry about that. A recent white paper that my friends at Gallagher Bassett wrote and published characterizes resilience as the following: its ability to gain the support needed when work becomes overwhelming, the ability to utilize established effective ways of managing stressful situations, and feeling supported by colleagues when stressful situations occur. Resiliency at its core is about cultivating genuine social support, right? An interpersonal connection. It impacts burnout among employees. That is to say that burnout can be controlled by one's ability or inability to cope with the work demands in addition to those external stressors that we've been talking about. Now, for those of you on the phone, burnout can manifest in a number of ways, such as the employee is emotionally or physically exhausted. Think through maybe some of the employees that you engage with that you're seeing some of these behaviors. Another sign of burnout could be the employee is somewhat cynical towards the organization or its leadership. The employee is decoupled or depersonalized from the organization's mission. Or the employee is showing a lack of self-efficacy or self-control over their work product. Burnout ultimately impacts engagement. Think of it this way: the more burnout being experienced by the individual, the more likely they will grow less enthusiastic about their job. And in the case of Michael Simmons, where his employees do have a direct impact on the value of their brand, it's of critical importance that Michael and in other organizations where frontline employees have a critical role in development of that branding goodwill in the community. So here's my next question, and this is directed at Tyrone and Mike. You know, employers, at least in my opinion, really do have the ability to create a work environment that ultimately helps to increase confidence. You're talking about confidence and reduce anxiety among its employees. The need of creating a sense of resiliency in the workplace is more important today than ever before, right? To help respond to employee anxiety around work availability, the other factors that we've been talking about. So can you tell us a little bit more about how your organization is creating a sense of resiliency among its employees? And I know you started sharing a little bit while I was offline. Can you tell us a little bit more about that? Let's start with Tyrone.
Yeah, I mean, what we did in addition to sending out communication and making sure that you know, we were clear with our communication is we've initiated over a half a dozen of surveys to the workforce just to get feedback. You know, we wanted to know from the workforce, especially those that were deemed essential workers and had to come to work or continue to work at their work locations. We wanted to know, was the messaging clear? Are we missing anything? Is there any concerns that they have that have not been addressed? And that was really key. We made changes based on the feedback that we got from our employee surveys on things that we thought we had covered, but maybe it wasn't clear enough, or maybe we didn't go as far as the employees would have liked. And some of it was just signage. You know, they thought the signage was too small, like anybody, you know, someone's going to miss that. They're not going to see that, you know, they're not allowed in the city facility, you know, if they have symptoms or they have a cough or something like that. We had the signs, but the wording was small to them. And so we looked at it and we said, okay, we need to change our signage. We need to get bigger signage. We need to add additional signage just to make sure no one can walk in and miss the messaging of, you know, are you okay to be here? And should you be here? And things of that nature. And we made other changes throughout the organization. And so that was just really key, is getting their feedback, not just sending one, you know, side message or message just being pushed out, but also to get feedback from the staff as to, you know, how they felt and what they would like to see the city do, you know, for them to keep them safe and secure at work.
Excellent. Mike, would you like to share any additional thoughts on the topic of resiliency?
Sure. I think that in the beginning, and even through, I'd say even to this day, we still have issues with employees being concerned about what their futures are like, and they rely on the employer to help them through that process. But some of the engagements we had with some of our employees, they involved really having to move into advanced conflict resolution because they were very irritated and they were very upset about the way things were, and they may have been listening to information other than what we were attempting to provide for them, and that noise in the channel for us all became about conflict resolution. I mean, we have a great people services department here, led by an awesome person, Joanna Blake, who just understood that from the get-go. And so it was all about attempting to tamp down the emotional part of it, try to make it about as much clean and clear and, you know, crisp information as we possibly could, make it as concise as possible. And then really give them that, again, that forum to come back and say, look, that wasn't what I was looking for, I need something else. And then we, as we mentioned earlier, we had that agility and that flexibility to get the information necessary for them. But there was a lot of conflict resolution that went on, especially in the first probably 4 to 6 weeks, when we're talking about furloughs and we're talking about the financial health of the organization for the short and long term. And people were nervous at all levels of the organization that they were going to have to move out into the unemployment line. And so it all became about how we dealt with that conflict and tamped down those expectations the best we could.
And Carlos, I think I might be able to tack on to Tyrone's and Mike's comments in that I think the important thing for people to know if they are suffering some of these effects that we're talking about is that resiliency is a skill to be learned. I mean, we're not necessarily born with it, but it can be learned as long as they understand what it is, understand how that this is an effective response to what's going on, and have some tools to learn how to do it. So I love that both of you are doing education for your employees so that they can understand that, yeah, they're in a bad spot right now, but there is a way out, and there is something that you can learn to help the situation.
Mhm.
Excellent input. Thank you for that. In addition to, let me advance my slide here. In addition to having a sense of resiliency, and Mike, you mentioned this word agility, right? And I think a critical element of any employer's ability to stay on top of responding to these dynamic challenges as it pertains to mental health with employees and other concerns outside of the workplace, the ability to remain agile or to be agile is incredibly important. From your perspective as employers, and Mike, we'll start with you this time, what would you suggest to the employers watching this webinar that they include in their toolbox so that they can support their organization's ability to be agile?
Well, I think sometimes people have a tendency to live in silos, and I don't think that as a result of that, you bring all of your resources to bear, specifically your internal resources. There's probably 800 years worth of experience in various departments within this organization. And we decided early on that we were going to bring all of those knowledgeable resources to bear for the benefit of the employee. And we knew that by doing that, we would get out in front of the crisis. We didn't want to be lagging behind. We didn't want to be looking at lagging indicators and providing that information 2 or 3 weeks late, and watching our employees lose any trust in the leadership here. So for us, it was all about, let's get out in front of it. Let's make sure that we are being as flexible as we possibly can, and then we build that trust with the employees. And because of that, because we brought every possible resource we could to bear, I really think that helped us remain out in front. And where if I will tell you from a personal perspective, if I go to ask my boss a question and he doesn't have the answer to it, and then he doesn't offer at that point to come back to me with an answer in a reasonable time frame, I'm probably going to start to question at that point the credibility as a leader. We made sure that didn't happen to us. That was a critical part of the formula for us.
Tyrone, from your perspective,
from our it's just that consistent and constant messaging, where we sent out updates as needed, and that messaging changed, and we were okay with that. In normal situations, you normally wouldn't send out information so rapid and sometimes contradictory to the last message, but we were okay with that. And I think staff appreciated that because things were changing and we did not have all the answers. But as the answers came in, as we consulted with our different experts, our medical professionals, the mayor's office, and that sort of thing, we sent out the message. And the employees kind of appreciated that because it showed that we were fresh and we were kind of up to date with our messaging. We weren't dealing with stale information that had changed, because again, when you're dealing with this many department heads and operating departments, one slip up could be very confusing for the employees and for all who are involved. So we just continue to change our messaging as needed. And we told the employees in the messaging that, this will change, and be flexible and understand that, we're working through this and we will keep this information as up to date as possible. So that was our approach to, sending the message and being flexible with just, the whole issue.
You really have to give employees something that they can be confident in giving them a message that they can be reassured by. And communication is incredibly, incredibly useful in your organization's ability to remain agile. Is there such a thing as over communication? And it brings me to my last point here, transparency. What role does it play in this whole thing? Is there too much information that you can share with employees? Is there a fine balance? I mean, Mike, what are your thoughts? What role does transparency play in WKS's response to COVID-19 and making sure that employees feel supported through this unprecedented time?
Well, I'm glad this is the kind of the last slide, because I think for us, and I mentioned this earlier, the transparency part of it was probably the most critical element of it. We wanted the employees to feel that we weren't holding anything back, that if we truly thought that the organization as a whole was at risk, we were prepared to bring that information forward and talk about how bad things were. And in fact, in many of our meetings, we talked about, and we provided, financial updates of the organization's financial health. And that can be a very scary prospect for people, but we felt it was necessary that the employees understood we're not holding anything back. There's not going to be, 11th hour surprise with us. We're going to make sure that you have all the information necessary to make decisions for you and your family. And that, I think that really was a critical element of it. Taking down those barriers and that isolation feeling that employees can get when they don't feel like they're part of the C-suite, or they don't feel like they're part of Mahogany Row, or whatever euphemism you want to use for it, really, I think, helped us. And I think it really gave us some mileage. I feel very comfortable that because we do these meetings still to this day, now, twice a week, and you should see that the feedback is now much more positive than it was in the beginning.
That's great. Tyrone, transparency, how much is the right amount from your perspective?
Well, transparency, I would probably venture to say that that's a little different from private and public. So we are as transparent as you can be in a public agency. So we share information that we can.
That sounds like a politician's answer there, Tyrone.
Hey, it's the honest truth. We share what we can, and sometimes that information, moves a little slower. And again, we are a public agency, so there are some things that is just a matter of public record. So in that regard, there is more information that you can find in a public entity than you can in the private. But as far as being transparent with employees in real time, that might not have happened as fast as it happens in Mike's shop. But we do, strive to get the information out there. But there was some times during this season where employees are a little uneasy. We were going through the potential furlough of city employees to help with the budget deficits and that sort of thing. And the information was kind of conflicting, no matter if you're talking to a labor partner or if you were talking to your manager. And so that was a very rocky time for us, but the information finally came, but it didn't come probably in the speed that the employees wanted it to come, but that's just government for you. But on the grand scheme of things, and if I leave it in the context of my role in workers' compensation, risk management, and that sort of thing, we send out messaging. When the governor issued the executive order, we made sure that we got that out and folks understood what that means and how we were going to interpret that executive order and things of that nature. All of our safety things, we send the message out and we try to be very clear and transparent, and we're open. I mean, we all have, open policies. You can call the administrator, safety administrator. You can really reach out to anyone if there's any questions about the messaging.
Dr. Browning, would you add any thoughts to that from a medical perspective, transparency, what is the right amount? And I just want to do a time check. We have about 5 minutes before we come up to the 1 o'clock hour. So I want to be respectful of time and allow a few minutes for Q&A from the audience. Dr. Browning, any closing remarks?
Yeah, I would just add on the transparency issue that part of transparency is to say, you know what, we don't know everything right now. There are some things we just don't know because employees are really concerned about, hey, your policy was this way one day and now it's a different way another day. And I think part of that transparency is to say, yeah, and things are going to change a little bit as we get more information, and we just don't know everything yet, but we'll let you know as soon as we get more information.
On that note, please allow me again to thank our very distinguished panel for such an engaging and thought-provoking discussion. We do have a few minutes for audience questions, and in order to submit your question to the panel or a particular panelist, simply type the question in the questions section on the bottom right-hand corner in your control panel. You can then select the recipient or recipients if you want to address it to everyone. And ask your questions, and we will do our best to answer those. So we will allow you just a couple of moments to enter those in.
Carlos, I see there are some questions already being asked, so if you want to grab those.
You know, for some reason, Diane, I can't see any of those questions. So would you mind just reading those out to the panel, and we can answer those as appropriate?
Yeah, Paul is asking, what is the standard for mental injury in California?
Are we asking about compensability?
It doesn't say, but I would say that's probably the case.
It would have to be the mental injury or illness would have to be predominantly caused by the occupational exposure or injury. So there is a 51% or greater that the employee would need to achieve for that claim to be compensable.
And I think before the presumption expired, it was probably a lot easier to get over that hump than it would be now that the presumptions expired.
All right. The next one I have here is I am interested in hearing from Mike and Tyrone about the experiences with COVID-19 and new workers' compensation claims, experiences as well as the recent information that total claims frequently is down approximately 36% year to date.
Tyrone, I'll let you start that one.
Yeah, thank you. So as I alluded earlier, our claim volume is up. So we're not seeing the reduction of claims as maybe some private employers may be seeing. In addition to the pandemic, we also had the civil unrest at the end of May that also increased our claims for our first responders. So with that, our claim volume is actually up, and we are, managing those claims.
And our claim volume is the direct opposite of that. Our work comp claim volume dropped because it's tied to labor. And when you close an abundance of restaurants, you lose that labor factor, which means you have fewer people working fewer hours, doing fewer activities. So we saw that go down. But as soon as the economy began to reopen and we started to reopen restaurants, then we did see a spike, but we're probably back to about where we were pre-COVID before the outbreak. So that's where we are.
Well, once again, thank you, Mike. Thank you, Tyrone. Thank you, Dr. Browning, for taking the time to share your valuable insight. We also want to thank Work Comp in Motion for hosting us today. Thank you so much. Diane, thank you for being such an amazing host as well. And why don't I turn it back over to you?
Well, I have one last question, which I think is pretty pertinent for most of you, from one of our viewers named Wendy. In a nutshell, she works for a TPA, and her company is having meetings as far as department meetings and company meetings, but the fun factor is gone. Do any of you have any ideas what they could do to connect everybody, because they are so isolated, being all teleworkers at this point?
Well, I'll just jump in. We began making our own videos. I mean, it's amazing when you put together a video that's about the business, but it's about the people in the business. and about how they contribute to it and how they're a part of something that's bigger than them individually. These videos have been taken really well and really accepted. Even kind of more so the fabric of this whole coronavirus thing. They just really like it. It's right next door to the office is right next door to me, where we have a green screen set up on the whole thing. So yeah, that's turned out really well for us.
Wow, that's a great idea. Any other ideas?
I mean, we just use the different video platforms for meetings, but we try to do the fun type of meeting, some type of game, trivia, something like that. We try to keep it light, but have those check-ins where folks that want to be involved can be involved, and it's just kind of change things up, a lighter pace. We don't talk about work, numbers, stats, or anything like that. It's totally for fun, entertainment, pleasure, and that sort of thing.
Well, that's great. I know one of the ideas that perhaps Wendy, you and your team can use is everybody bring their lunch in, get onto one of these video platforms and do exactly what Tyrone's talking about. Maybe play Trivia Pursuit, maybe play, Liar's Dice or something like that, and have a good time. Well, thank you, gentlemen, very much for your outstanding presentation. Now, before we switch to the next slide, so if you'd hold for just a second, Carlos, I would like to thank two of our sponsors that got missed in the very beginning, Corval. We'd like to thank Corval and Siegel, Marino, and Stetler for their participation in Workers' Comp in Motion. They are a big part of our organization, and we do appreciate their sponsorship, as well as all the other sponsors. Now today, our sponsors are providing door prizes to some of you. So Carlos, if you would give us the next slide, we will show you our sponsors and the door prizes that they're giving away. So while you're looking to see if your name is in there, I just want to remind you that you will be receiving your 1-hour CEU certificate coming in your email tomorrow. It's going to say your certificate has arrived. You need to make sure you click onto that blue button to download that. So if your name is listed here, our sponsors will get a hold of you and reach out to you to get you your prizes. Well, gentlemen, thank you once again. We thank you all for participating in Work Comp in Motion. We'll see you at the next event.
Thank you.
Thanks, everyone.
Thank you.
Thank you.